Welcome to the Takeout. Welcome to the Conversation Corner. And welcome to my San Diego chicken socks. They're really great. I hope you love them as much as I do. Might have missed it during Tuesday's very long State of the Union address, but there was a brief mention. President Trump invoked his new cash-only online drug platform called TrumpRx. There you can find discounted generic prescriptions from about 43 medications overall. John Stanford is here to talk to us about that from Charlotte. Why? Well, he's executive director at the venture capital firm Incubate, where he focuses on prescription drugs. John, I'm very glad to have you with us. Just for my audience's benefit, give me your point of view on this. You're not in a think tank. You're not a member of Congress. You don't regulate this. How do you approach this prescription drug market? And secondarily, how do you evaluate what is good or maybe not so good about TrumpRx?
Well, Major, thanks for having me on. Venture capital is the lifeblood of the early stage biotech ecosystem. It's too risky for anyone else to touch it. So myself and our colleagues, we're here to work with entrepreneurs to bring new medicines forward. And it takes about $3 billion in about 15 years. So we're in it for the long game. And I'd say over the last 5 years or so, you know, beyond the science, we have to pay attention to what Washington is doing and how we're talking about prescription drugs and frankly, our broken healthcare system overall. So we were all ears to many things that President Trump said because water flows or capital flows like water. And if policy barriers are in the way, we're going to invest somewhere else.
Got it. What about TrumpRx?
Well, I think TrumpRx, you know, it's one of many cash payment platforms. And we're excited to see the president bringing his bully pulpit to let people know that there are alternative ways to access medicines that can be transformative for people's lives. But what we didn't hear out of the TrumpRx conversation is why we have to have this conversation. Why is it that people with health insurance have to be considering cash alternatives? And it's because insurance just isn't insurance anymore. We've got deductibles that are $20,000 for a family of 4. We've got people, when they get a prescription from their doctor, they're on the hook for the first $500, $1,000, $1,500, things Americans can't afford. So we have this incredible set of medicines that can transform people's lives. TrumpRx is one platform that might help people pay cash to get them, but we shouldn't be having that conversation. We should be having a conversation about health insurance reform, and that was missing in the president's speech.
You also talked about the importance of capital flows. What will capital flows do in response to the other thing President Trump regularly touts, which is most favored nation status for drug prices, essentially bringing prices in America down to European levels?
Well, we don't have to hypothesize on this one. We learned late in the Biden administration what happens when you put price controls in this area. The money goes somewhere else. For example, pills were created under the Biden system to be less valuable than biologics. What did we immediately see? We saw venture capital move all of their money into biologics. So we understand what most favored nation is trying to accomplish, but it's the wrong solution to a much broader conversation about why Americans can't access their drugs. And notably, President Biden didn't see the pickup under his price controls that I think President Trump would be hoping for with most favored nation. So it may not be a political winner, but we know for certain that it's a loser for American competitiveness. Our venture capital will go somewhere else if we bring in European-style price controls. Europe learned this lesson. Japan learned this lesson. We know that if we want America to be the front line of the world's medicine cabinet, then we've got to keep our VCs investing here.
John Stanford, I appreciate the perspective. Thanks so much.
Thanks, Major.